Some patients who undergo facelift surgery return to their preoperative form rather quickly. We call this a stretch-back phenomena. We've stretched their face, we've pulled it back, and in some patients, about 10% of them, they will prematurely start to sag a little bit. This is an indication for what we call a mini facelift. Some people 2-3 years out will start to sag a little bit, which is shocking to the patient and myself, but it does happen. And what we then end up having to do in some of these patients is just re-excise part of the incision around the lower ear, go in and tighten up this part of the face on both sides, and that's an indication for doing a mini facelift. And it does happen, and it's totally unpredictable when it happens, but it does. And when it occurs, yeah, we just book you for a mini facelift to tighten things up and solve the issue. Some patients come into our office here at the Younger Facial Surgery Center indicating that they may need what we call and what they call a mini facelift. And indeed, a lot of the times a mini facelift will give you a mini result, and it may not be the result that you're seeking. And so there are some patients who come in and they think that, well, I'm 32 and if I get this done, I'll be like I was when I was 25. And in most circumstances, a mini facelift may be somewhat premature, and it's best to wait another 5 to 10 to 15 years because it's going to make very little difference to you in the long run. But the one indication for a so-called mini facelift indeed is the patient who has stretch back phenomena, and we just do a mini tightening which solves that issue. But as a primary lift, it typically makes very little difference for most of our patients. Concerning the aging face, there's really two big options available to us to treat some aspects of gravitational aging. And one is using injectables in the face, and there's many practitioners who use a ton of injectables, but if you've really got gravitational aging, you're going to have to put in a boatload of injectable product, and sometimes these patients end up not being able to move their face very well. They have a bit of an unusual facial countenance after they've had a ton of injectables, whereas it seems strange, but the most natural and best result that we see with the aging face is not injectables, but it's rather interventional surgery where we perform a facelift procedure, because the face moves in the long run normally, naturally, whereas if you've got 5 or 10 cc's of injectables into your face, the face may not move so well, and it may look a bit unusual following that sort of procedural intervention. If you want to address the aging face, give the Younger Facial Surgery Center a call, and we can address this for you.